hopelessness and suicide. Now, so patient again may have negative views of the future. Nothing is going to be good for me, everything is black, very bleak. What if tomorrow never happens for me? So these feelings of hopelessness, and subsequently they may be associated with suicide, they may be seen. And again, many times we believe that asking for a patient about suicide, it may increase the likelihood of suicide. No, there is no basis of that asking about suicide increases the risk of suicide. In fact, it's vice versa. At times when you ask or inquire about suicide, tells the patient that you are the doctor is sensitive towards or knows the severity of his problems and is trying to inquire. So it's always good and always make it a habit to ask for these symptoms, especially suicide in patients with depression. So there is no basis that by asking the risk of suicide would increase. Okay, in fact it is the vice versa. Now when we talk about suicide in depression, it is seen that around two-thirds of the patients, they contemplate suicide. They think of suicide, and around 10 to 15% of the patients actually commit suicide. And in fact, suicide, depression is one of the most common psychiatric illness associated with suicide. So again, very, very important. Again, this data is again very important, you should remember. Now when we talk about risk of suicide, it is seen at times that it may be less severe. The risk of suicide may be less during an acute severe depression, because the patient is having so severe negative thoughts. The patient may think, that I don't exist, I'm already dead. So patient may not think of suicide. So at times it is seen in acute severe depression, the risk of suicide may not be that high. Now, Emil Kraepelin again observed, something very interesting, that when psychomotor activity of the patient is improving, and usually when you treat the patient, so we see that there is improvement. Thinking of the patient is still negative, so this is more likely that the patient may now attempt suicide. So what is observed that again, so let's try to understand this in this way, that there is an increased risk of suicide as the patient begin to improve and regain energy needed to plan and carry out the suicide. So a patient, you are seeing a patient having severe depression, having suicidal thoughts, but the patient has not attempted suicide. You started the patient on treatment, you started medicines, or you started therapy. So clinical picture, when you see what I'm trying to say, that suppose you are seeing a patient of severe depression with suicidal thoughts, and if the patient has not attempted suicide, and you started treatment, you started drugs, and also maybe let us say you started therapy, but an initial phase of the treatment, you learn that the patient has attempted suicide. So why is this happening? Because the patient still is having negative thoughts. The negative thoughts have not gone, and now there is improvement in the activity levels, in the energy. The patient has gained energy. Now he can carry out the plan and attempt suicide. So one should be very careful, and in fact this phenomena is known as paradoxical suicide. So very interesting. Again, the word paradoxical means something which should not happen is happening. So when you were not treating the patient did not attempt it, but when you initiated the treatment, now the patient has attempted suicide. So this is paradoxical suicide, which is usually because of gain of energy. Now the patient may carry out the plan. Patient may say, sir, when I was having very severe depression and there was no treatment, I even didn't have the energy to attempt suicide. So this again is important. You should know what is paradoxical suicide. Also, Aaron Beck, his work showed that hopelessness, in a patient recovering from depression, again is an important risk factor for suicides. When the patient, says that, there is no hope, for tomorrow, you are planning to discharge a patient. When you talk about his future plans, the patient says, don't have any hope, anything good will happen. So be very careful. The patient has hopelessness. There is increased risk of suicide in patients with hopelessness. So again, very, very important. This is again another important risk factor. Okay, and again, deliberate planning. When the patient says that there is a deliberate plan, again that is also an increased risk of suicide. Now, when we talk about suicide in patients, it may range just from passive wishes that the patient may just wish that I wish I would not wake up in the morning, or there may be belief that others would be better off if if I'm dead. So such again such wishes may be there, and it may be more severe that there may be transient but recurrent suicidal thoughts may occur, and it may become even to more severe uh, suicidal thoughts, that the patient is having specific suicidal plan. For example, they have put their affairs in order, they have said goodbye to their friends, they have made their will, and also they have also acquired the material which may be needed, like a rope for suicide, and also they have decided a location or a time. So when a patient has such specific suicidal plans, again the risk is very high. So again, it may be it may range from passive wishes to specific suicidal plan. So these were the cognitive disturbances which may find in the patient.